Hello, everyone. I'd like to welcome you to Pediatric Grand Rounds. My name is Mel Hyman, and I have the pleasure of introducing our Bramham Nutrition Lectureship today. And I'm going to start out just by giving you some background of what this Bramham Lectureship is. This is named for the Bramham family. James Bramham was born in Taft, California, and attended medical school at UCSF, graduated in 1948. And after completing his training in residency at UCSF and San Francisco General Hospital, went into practice in Sacramento. He had a special interest in caring for premature infants and developed and staffed a clinic for all premature infants that were born at Sacramento County Hospital. When UC Davis Medical Center opened, he joined the clinical faculty there and later became an associate clinical professor in pediatrics. He married Roberta James in 1944, who also was trained and received a BS and Certificate of Nutrition and Dietetics from UC Berkeley and UCSF. They have two children, Jane, who received her MD here at UCSF in 1975, and she's now retired after practicing in oncology. She lives in Nashville, North Carolina, and I think she's on Zoom. Hi, Jane. And Jim owns a transportation logistics company in Sacramento, and he also, I think, is joining us through Zoom. Through their generosity, we've had this professorship now for over 20 years. And so it's my pleasure to introduce to you Dr. Craig Gunderson, who is professor of economics at Baylor University in Waco, Texas, and is a distinguished scholar and expert in the field of hunger and poverty. He currently holds the Snee Family Endowed Chair at Baylor Collaborative on Hunger and Poverty. It's a research center that focuses on finding sustainable solutions to hunger and poverty in the United States and around the world. Dr. Gunderson's research is centered on understanding the causes and consequences of food insecurity, poverty, and public policy, with a particular focus on nutrition assistance programs such as SNAP, the Supplemental Nutrition Assistance Program, and WIC, Women, Infants, and Children, that we're all familiar with. He's published extensively in peer-reviewed journals and is frequently sought out for his expertise on issues related to hunger and poverty in major news outlets and policymakers. He's received numerous honors and awards. I'm not going to list all, but I will note a few, including the 2021 Hunger Hero Award for from Feeding America, the largest hunger relief organization in the United States. The 2020 Roy Buck Faculty Award from the College of Aces at the University of Illinois, recognizing excellence in teaching, research, and outreach. And the 2019 Outstanding Research Award from the Association of Public and Land Grant Universities, recognizing his contributions to social sciences. As the 2023 Bramham Nutrition Lecturer, Dr. Gunderson brings his extensive knowledge and expertise to bear on the pressing issues of hunger and poverty in the world today, in particular in the United States. In addition to his Grand Rounds talks, you're all invited to join us for a discussion at 2 p.m. in Mission Hall, room 1407, where we'll be talking on possible directions for food insecurity research in an era of substantially lower rates of food insecurity. Please welcome Dr. Gunderson now for his presentation on the critical role of...
Your attention, please. The nurse call system is undergoing routine maintenance. The code buttons are non-functional. All code blue and code white emergencies need to be called into 41234. Once again, the nurse call system is undergoing routine maintenance. The code buttons are non-functional. All code blue and code white emergencies need to be called into
So we will eventually be talking about the critical role of SNAP in reducing food insecurity in the United States, and that's the risk of being in a medical center. Great.
I wanted to begin by thanking Mel for inviting me to give this. We've never met each other before. I was so happy and pleased to have this opportunity. We've been having a great time talking this morning. I hope you agree. And so we've really been enjoying our time together. And I want to thank the Bramham family very much for this opportunity to speak here. I really appreciate the generosity of your family and welcome. They told me that since I'm on Zoom, I should stay within the parameters of roughly here, right? Right. Okay, roughly here. Okay, so Big Ten for okay, so that's good. So I'm going to be. So I want to thank all of you. This is you all have a lot of other things you could be doing right now. I know people in the medical profession are really busy. So I really appreciate all of you being. I genuinely do. I thank you so much for being here for this today. So if you all don't mind, I'm going to use the way we call economist rules. Is that you interrupt me constantly throughout my presentation. In other words, just don't wait for me to get to the end and then ask questions. I really hope that you'll ask questions throughout this so I can kind of get a sense of what is what is of interest to y'all, what's not of interest, or things like this. Okay, so please interrupt me at any and all points. Okay, let's get started. Okay, so the first thing, and I was going over some of the other presentations because I could see the other ones on Box that's been for these grand rounds. Mine. I don't have any pictures. I don't have any, different things that oftentimes you see on these things, pictures. But anyway, this is kind of drab, but I hope it's still okay. And so, just so you're aware that it's going to be a little bit different in style. So the first thing I think it's worthwhile for all of us to begin, many of you are familiar with how we define food insecurity. I think it's important to say, here's how we define food insecurity, and here's what we mean throughout this presentation today when we say food insecurity. And there's a series of 18 questions on something called the core food security module. And this was first implemented in 1996, and has been on surveys in a consistent framework on the current population survey, where most of my research that I'll be presenting today comes from, is that so these are 18 questions it's posed on many national representative surveys, either in the full 18 items or a subset of that 18 items, 6 items and things like this. And I'm not sure if they pose what's called the 2-item scale at UCSF when people come in or check in. Are they posed 2 food security questions? Okay, great. So that's an example of something where it's been used in different contexts. Food insecurity has become the leading indicator of well-being for vulnerable families in the United States today. Okay, poverty used to be the main indicator, but now food insecurity is much more closely followed by those who are interested in the vulnerability of vulnerable families. And these are some of the examples of questions. They range from the least severe, basically again, this notion of worrying, whether I worried whether I bought a food or not before we got money to buy more, all the way up to the most severe. Did a child in the household ever not eat for a full day because you couldn't afford enough food? Okay. So fortunately in the United States, this final one is rarely affirmed. So a couple comments about this is, first of all, is all of these questions are episodic. I mean, they refer to something that's episodic. In other words, this is not happening every month of the year on average. It's definitely not happening every day in any month in the year either. So these are episodic things that this ever happened. Sometimes the questions are posed over the previous 12 months. Sometimes they're posed over the previous 30 days. Okay? So you give a time frame for them. That's the first comment about it. Second comment about it is that all of these things are things whereby they refer to the lack of food, a lack of resources to purchase food. So, for example, it's Ramadan now, and so right, I think it is. Yeah, is it? I think it is. Okay, yeah. So during Ramadan, if somebody's not eating, from sun up to sundown, that would be by their own choosing. If they also didn't have enough money to afford food, then they could also say that I respond affirmatively. So they all have this notion about not being able to purchase enough food, for better or for worse. I mean, I can make an argument why we shouldn't have these resource questions on here, but it's always posed there. So those are the two things that I would say about these questions. We then say a household is food insecure if they have 3 or more affirmative responses to these questions. Okay, so now note, is if somebody's affirmatively 2 of these 18 questions, they're considered to be food secure. It's the hurdle, you have to be 3 or more. I worked at USDA when these were originally implemented. I was at USDA before going into academia. And it was funny, is basically how was 3 chosen? Somebody asked me that the other day. Well, they had to, what they thought was a reasonable number of proportion of food insecure people in the United States. That's literally how it was chosen. I mean, it's kind of a crazy way to, well, I don't know, maybe it's, what's crazy, what's not crazy, but at any rate is that's how it was chosen. It was 3 or more affirmative responses, okay? And then the more severe one is something called very low food secure. I'm going to be using both of these measures throughout the thing today. Now, one comment I want to make is that, I know I'm speaking to a pediatrics department. Okay, so, but I'm going to be talking about people across not so much seniors, but people across the lifespan, which I think is probably from my perspective, the right thing to talk about, because some of the same issues facing children, facing other things. The other thing is things like, I'm going to be talking a little about the challenges facing single persons between the 18 and 59. A lot of these, recently were children, but a lot of them also may be non-resident fathers or something. So in other words, I'm going to be speaking very broadly. I'm not just going to be speaking about children. I hope that's okay throughout this, but if people object, not much I can do now. Well, there's something I could do now. I could talk about some things less or more than other stuff. Okay, so yes. Great question.
One about there's also a feeling like interest. So different than the quality and addition to the quantity.
So the way I usually respond to this is in a couple of ways. The first thing is that there's really no measures of the quality of food, because as all of you know, it's very difficult to measure the quality of the food that individuals are making. So no, there's no sense in trying to measure that in the context of, the closest thing is there's a question about balanced meals, but even as you all know, what constitutes a balanced meal is very different for somebody like me versus somebody else, and so is that you get some of these differences across these different things. The second comment I make about that, though, is the fact that there is, we do know that those persons who are food insecure have lower nutrient intakes across the board. So in other words, if you know they're food insecure, they're going to have lower nutrient intakes, so these different things. So in other words, even though they're not measuring it, it happens to be the case. Yes?
Do people tell the truth on these surveys?
So this is always I have one paper that came out.
Can you repeat the question for people?
Oh, yeah. I'm sorry. The first question asked me, where did I get this nice suit? And I was kind of split. Well, I'm sorry. The first question asked about whether or not there's any notions about the types of food that people are eating. And then you heard my response. This question is asking about whether or not people don't tell the truth on these questions. Okay. So this question, I'm again going to pose the thing is, we don't know. Okay. There's a few things going on I'll try to respond to this in a few different ways with respect to this. The first thing is of course, this will to some extent depend upon people's frame of reference. If somebody is, let's take the first question. I worried whether our food would run out before we got money to buy more. If somebody's every single month they're struggling, they may I'm not going to worry about this anymore. I know this is going to happen. So they may say no, but in some objective sense, we say, well, you should be worrying. It's just sad that you're facing this. Or to take another example is, you have to cut back on the size of my meals. If somebody was eating a lot more before, then they had some sort of economic shock that caused them to eat less, then they say I'm eating less because of this. Okay. So you may have people misreport. That'd be one is overstating, one is understating, depending upon how we see this. So there's definitely that. There's also some evidence that people may underreport or misreport for policy reasons. The first policy reason is that some people, if they're getting SNAP, they may, and I'll talk a lot about SNAP later. If they're getting SNAP, they may say, if I tell them I have enough food, even though I'm guaranteed an anonymity on the survey, and I tell them I don't have enough food, are they going to say, well, you don't need SNAP anymore? So some people may over-report their food insecurity if they are on SNAP or something similar. A lot of these surveys are done within food pantries, agencies of food banks. Is in those things is that they would have they may be reluctant to say that they're food secure because they may say, oh, well, you don't need any food today, so therefore they may overreport. You could also go the other direction, though, is if you look at some of these questions, and I've heard this in some contexts, if you look at some of the things, if Child Protective Services, they may take a child out of for various reasons, for abuse and things, but a child not being fed is one potential thing. And even if it's not an abuse situation, it's a poverty situation, that child could be. So in other words, somebody may be reluctant to say, yeah, my child is skipping meals all this week because they're concerned about this. Again, even though they're assured anonymity, actually, I wouldn't believe it. If somebody told me you're anonymous, I'm like, yeah, you could say that, but technically, yeah. But anyway, so does that kind of get at what you're getting, or are you trying to get at something different?
I'm just interested.
Okay, yeah, okay. So, okay. Well, these are great. Please keep interrupting me.
Your attention?
Okay, no, but not you. I didn't mean you. I meant this. I'm just going to talk over this. Okay, is that okay? Is that okay? Or do we have to sit there and listen to it?
Go for
Once
it.
again,
Okay.
maintenance of the
Okay.
nurse call
Okay.
system has
Okay.
been completed.
Okay.
All call buttons are operational.
Okay, good. So if any has a problem, it's just like, get me out of this room because this guy's talking crazy stuff. But anyway, okay. So the question becomes then is why should I, and this is something, so why should all of you care about this? Okay. Because I think a lot of you like, I was hoping to learn about, something else, but I'm going to present 3 reasons why I think personally, I think it's important. The first is that from my perspective, the fact that a child isn't getting enough food, that child is going hungry for whatever reason, that's a problem in and of itself, in my opinion. Even if there was no other negative consequences associated with this, the fact that a child is not eating is a problem, or anybody. But let's talk about this as a pediatric thing. The other thing is if I was given this presentation and I don't know, the DRC or Malawi or something, is you could be like, our country doesn't necessarily have the resources in order to address this issue. In the United States, this is an easy problem to reduce to almost nothing in the United States. Okay. And I'm going to talk about that in my afternoon presentation a bit more, but less so in this presentation, is we can solve this problem. In fact, I have a paper that came out in 2021 in Food Policy, where basically I talked about if we redesign SNAP as, in essence, kind of a modified universal basic income type program, we could reduce food insecurity rates by 97%. Okay. In other words, it'd be expensive. The cost I have, and that is estimated about $500 billion. Yeah, we might say that's too much. We don't want to do that. We always have to make fiscal decisions. But what I'm saying is something that can be solved. And so I think that whenever we have a problem, we can say we can solve it. I think we should try to. So, okay, that's the first thing. It's something you all may be concerned about because it's something that we can solve. The second thing is that there's a huge literature on the negative health consequences associated with food insecurity. So if you can identify, again, back to this 2-item screener that I've talked about earlier, if you're able to identify those who are food insecure, there's actions that you could take. And also the fact is, if you observe that somebody's food insecure, there is a whole series of other health consequences that are associated with this. Okay. So in that sense is that you all may be interested in it from that standpoint. And the third one is that there are substantially higher healthcare costs associated with food insecure. So do any of you know Hillary Seligman? Okay, so one of you do. So Hillary is a good friend and co-author of mine, and she's here at UCSF. She says she's sorry that she's not here today. She had some other apparently more important thing. No, I'm just joking. I was happy when she was able to create some time, but now I just got an email from her that she's not feeling well. So she may not be here. But anyway, Hillary's for those of you who don't know her, please get to know her. She's fantastic, really nice too. She's, sometimes you meet people in academia, they're not very nice, but she's really nice. And that's important, I mean, so you're always a little bit concerned when you start talking to some of these people. Oh God, sometimes, that was great talking to Mel. I mean, we had a lot of fun this morning, but sometimes you're like, oh man, I have to listen to this again. But anyway, here's the thing is that she's written this nice paper with Seth Berkowitz, who is now, I think he's at UNC, I believe. And he's doing some great work on healthcare costs. And I've written one paper with them, but they've done most of the work. So they want to deserve credit. But so this is a big deal. Food insecurity adults have $2,000 per year higher healthcare costs than those who are food secure. Okay. This is even after controlling for other, at least observed characteristics. Okay. So the potential savings, if we got rid of food insecurity, is about $40 billion per year. If these extra costs were also similar for children, that's $60 billion a year. This is a concrete figure. So in other words, as we're always worried about healthcare costs, I mean, one relatively simple and straightforward way to reduce at least some of these healthcare costs is to make people food secure. Okay. So these are some of the reasons why I think you all in the healthcare, and you probably have lots of other reasons why you might care, but hopefully this is useful to motivate this. Then I'll go in and give the same presentation I give non-healthcare professionals. But anyway, at least I have this slide up here to show you why. Okay. So in thinking about food insecurity, it's really a pretty simple thing. Okay, is what are the determinants of food insecurity? The first thing is what are the resources available to a household? In other words, what does a household have to spend on food? And this is mainly depends upon two things. It's first of all, economic growth. Okay. We need enough economic growth in our society in order to make sure that people have the resources in order to escape food insecurity. Okay. We also have to have economic growth in order to afford the programs that I'm going to be talking about. Okay. In particular, SNAP. Is you could only have SNAP in a wealthy country. You can't have SNAP in a lower income country. We see this. We don't have SNAP in or equivalent programs in low income countries because they can't afford it. So you need this economic growth. We also need a strong social safety net. And this can't be emphasized enough, is that without a strong social safety net, you can't get rid of food insecurity or other problems associated with poverty. I mean, people always point to the Nordic countries as like an example of areas without much issues of poverty. True. The reason why is because they have incredible social safety nets. So one is, per the title of the talk, that I'm going to talk a lot about is SNAP, of course, because that's the thing. But I do want to talk about charitable food assistance. Charitable food assistance plays a critical role in the food security and our efforts to alleviate food insecurity. I could talk a lot more about this, and this afternoon I'm going to be talking a lot more about this. But for now, I'm just going to mention it as one of the key components of the social safety net. Yes.
Just want to say that I'm really glad that you only said nice things about Hillary Seligman, but she's in the Zoom audience.
Oh, she did. Great, Hillary. Okay. No, that's great. Well, I'm glad she's there. I'm glad you're here for this, Hillary. Yeah, no, she's great. So I'm not going to talk much more about social charitable food assistance, but I'd love to talk more if people have questions about that. Okay. The second key component of determined food is prices faced by a household. And this is both food prices and the prices of other things. Okay. This is why, I mean, people say this all the time, inflation is the cruelest tax on poor people. And it's true. I mean, for those with incomes in middle to upper incomes, it doesn't really matter if inflation really doesn't have that much of an impact on their day-to-day lives that much. I mean, to some extent, I mean, but is it for a low-income house? It's a huge deal. So we need to do everything we can to keep prices low, especially food prices. Anything we can do to keep those prices low. So in other words, the whole field of food insecurity really comes down to these two things: resources and prices. Now, how much resources somebody needs depends upon a lot of different factors. I'm going to talk about some of those, but these are the key determinants to think about in terms of all this. Okay, now I'm going to now turn to what's happened to food insecurity since we've had a consistent measure and consistent time period of food insecurity in the United States. So what you see is this is from 2000 to 2021. And a couple of things I used to talk about various different things, but I'm going to talk about just a couple key things about this. First of all, as you see what happened in 2008, huge increase. That was the Great Recession. Was a huge increase in food insecurity, unprecedented. Okay, well, not unprecedented. Probably if we could go back to 1980 to 1982. I'm from the upper Midwest originally. I'm from Wisconsin, and that was a really bad recession when a lot of automobile plants and stuff were closed. But at any rate, is that you see this huge spike up. The other thing is that it took for a while for it to come back down. But what I really want to concentrate upon, and though everybody in Zoom can't see this, but is starting here, is there's this huge decline, 2014 down to 2019 in food insecurity. That's due to, these was a time period of strong economic growth in the United States, low poverty rate, low unemployment rates, high GDP growth, okay? Strong economic growth over this time period, okay? Also is, and I'll come to it later, is SNAP was really expanding a lot over many different dimensions, okay? So this is why we see this sharp decline in food insecurity over this time period, okay? Now, COVID hit is, people were really worried during COVID. COVID was worried that this was going to cause massive increases in food insecurity. And in fact, a lot of people were saying that we'd have something like this. In fact, including my colleagues, I do a lot of work with Feed America, my colleagues at Feed America, and our projections, we had a lot of people out there making crazy projections of what happened to food insecurity based upon next to nothing. And we made some projections, and we predicted that food insecurity rates would rise up to about 48 million. So we actually kind of thought that food insecurity rates might go back to what they were at the 2008 level due to some of the projections that were happening in poverty rate, unemployment. Fortunately, we're wrong. We were completely wrong in our projections, okay? We are less wrong than some of these people are making outrageous claims, but we were still wrong. Food insecurity rates hardly rose at all in 2020, okay? And then they basically by 2021 we had reached all-time lows in food insecurity rates. And even in 2020, they were below what they were in 2017. Yes.
You might be getting to this, but isn't that potentially partly because the social safety net actually got a lot more robust?
Right.
Oh, does the cost?
Yes, that's exactly what I was going to just talk about. So in response to your question, no, no, that's exactly. But so, repeat the question. Why did food insecurity rates not increase during COVID? Please give me your 4 reasons that you think this might have happened. Okay. So the first reason was that there was an incredible amount of, I guess I would say, there's a massive amount of stimulus. Stimulus checks are being sent out to just about everybody up to really high income levels. You had expanded unemployment benefits. You had all these things, which were great. Is that there's a key component of why food insecurity rates increased. It wasn't, probably in retrospect, and this is not to blame the Trump administration for this. I don't think they quite how best to do this, but it went to a lot of people who probably didn't need the benefits, And so, but that was the first component of it. So a lot of these cash transfers. The second component thing I would talk about that I want to emphasize a lot is SNAP. Okay, is what happened when SNAP was at the outset of COVID is everybody's benefits were bumped up to the maximum level. That's not a good idea in normal times, and I'll explain why it's not a good idea in normal times, but it was a good idea so we poured tons of money into SNAP. Maximum benefits were in the second phase increased a little bit. Okay, so and we also had pandemic EBT programs for children who were in school. And so just a lot of great things. So again, SNAP boomed. And I think that this, from my perspective, that was probably the most important component. And I'm going to talk about it a little bit later. That was probably the most important component because it was really directed towards those who were most in need at that time. So I think that's the second thing. Third thing is charitable food assistance. I mean, fine. I love Feeding America. I just love Feeding America. And the food banks of the Feeding America, they really stepped up during COVID when things were, the federal government's great at some things. They're not so great at other things. They're great with SNAP, but it's hard sometimes to mobilize things quickly. But our food banks mobilized quickly. And also a lot of very generous donors came in and gave a lot of money to food banks, allowing this to happen. So that's the third thing that's the thing. The fourth thing that's often overlooked is our amazing ag supply chain in the United States, okay? We have a global pandemic and grocery store shelves were full, okay? There was, fine, some things, like I remember one time I was going to cook something with angel hair pasta and it wasn't on the shelves. So that was rough for me. That's one of my COVID stories, how rough that was. Had to switch out a different type of pasta. But at any rate, in the main, everything was there. And also food prices didn't rise. Food prices, again, back to my thing about resources and prices, bringing up resources, keeping prices down during COVID. We have an amazing ag supply chain in the United States. And nowhere did that come out more to the fore than it did during COVID. So those are the four main reasons why COVID really didn't have us. I think these are some really important lessons that we can learn about this. I mean, recently there's been some inflation. That's a problem. Now we know that it didn't increase during COVID because there wasn't inflation. Now we have inflation. That's an issue. Or secondly is, I'll talk about it later when I talk about SNAP, is if you want to make people food secure, put more money into SNAP. I mean, just do that. I mean, it's really pretty simple. A lot of these things are so simple to solve these problems. Just put more money into SNAP. Okay. Okay, answers your question. Okay. Okay. Satisfied. Okay.
Can I say?
Oh, of course. No. Say something more. Say I'm unsatisfied with that question.
You're probably gonna go here next, but which is as we take away all of those supports now.
So, okay. So I would say there's two things about that. Is the first thing is that overall SNAP benefits are much higher than they were in 2019 because the value of the thrifty food plan increased by 20%. Okay. So overall, people have much more resources than they did in 2019. Two things were taken away: the emergency food allotment. So everybody was bumped up to the maximum, which for most SNAP recipients, it wasn't a lot more money. For some, it was, especially seniors, but roughly 40 to 50% of people were already getting the maximum SNAP benefits. So they didn't get any more during this. My understanding is pandemic EBT is going to become a permanent program for children over the summertime. So some of these programs are going to stay. There's really only one aspect of it that's going away, is bumping everybody up to these emergency allotments, and we can have a further discussion about this, why in the short run that may make a difference, perhaps, but this was a bump up temporary. Now, the issue, and so that's the first thing. The second thing you just talked about, inflation. My preference would be to have USDA update the SNAP benefits more than once a year. They currently are updating them once a year. In times of low inflation, that's fine. But at times of high inflation, they should be updating this, twice, 4 times a year, especially since everything's on an electronic card. It's not like, you got to print some more coupons. I mean, it's not like in the olden days, you can just put it right on there. Let's update this more regularly.
How it works is to take the person who has the benefits. Is that kind of like a labor intensive process to do yearly?
Yeah. So this question is about the application process for SNAP, and also as part of the recertification process. Okay. So another thing that I forgot to mention when I was talking about COVID is the government made it much easier to apply for and receive SNAP benefits. I'm like, well, why not? If it's good now, why isn't it always good? I mean, why not make things easier for people to get on the program? I mean, if I had my druthers, this would become like universal basic income program. You automatically get it. And then but anyway, it's getting easier and easier to apply for SNAP, which is great. The challenge oftentimes is not getting people on SNAP. The challenge is keeping people on SNAP. Is this recertification process can be rather cumbersome for a lot of SNAP recipients. Okay, one of the determinants of food insecurity is basically, to lack of a better term, is disruptions in the family, chaos in the family household, and things like this. And also having to remember to sign up for these things, do all these different things, bring all this information in. It's a cumbersome process. So if I had my druthers, we'd set a longer recertification time period and also make it a lot more seamless. I mean, so you have these cases whereby this was in Illinois. This case was in Missouri, but Illinois was even worse. They would send out notices to people that you have to come in to be renewed for your SNAP benefits, and the notices were sent out 2 weeks after their appointments. Yeah, so they left the program. And if you look at those who leave SNAP, is that roughly, I want to say like 70% are back on the program 1 month later. Out of those who missed the recertification, maybe it's not 70%, it's probably like 50%. But a lot of them did not intend to leave SNAP. I mean, some did. Some are like, I'm doing fine. I'm not going to recertify. I don't need these benefits anymore. But a lot, it's what we call churn in the program. Does that answer the question? Okay. Okay. Now so this is a child specific one. Here's the trends in food insecurity amongst children. Okay. Here you see is that the decline is even more. okay, is, like, let's say back in, 2000 and 2008, prior to the spike, you had food insecurity rates of 18%. By today, it's 12%, and the numbers are far below what they were over this time period. Okay, so great news. I mean, this is great news about how much food insecurity rates have fallen amongst children. Okay, now, conversely, is what I'll tell you is I'm not going to go into it too much, but it's those between 18 and 59 which have seen not the great declines, which is why the moderation in this is not as great as the moderation in this. There's a few different reasons for why it's declined more amongst children. One of the key reasons is, and I'm going to come to this later, is SNAP is not quite universal, but pretty close to universal amongst eligible children. It's really, really high, that's part of the reason this has fallen so much.
Are undocumented children and families part of this data?
So So the question is about whether or not undocumented children are part of this data. The answer is again, yes and no. Yes, whenever they go into the current population survey, no questions are asked about, the questions are asked about citizenship and things like this, but there's nothing saying, are you documented? And then if so, you can be part of the survey. So they should be part of this. If I was undocumented, I would be like, I'm not answering the survey. So in other words, that's why I say yes and no, is that conceivably they should be a part of the survey, but they're not. In terms of what I mentioned about SNAP, is undocumented children are not eligible for SNAP, but if somebody is in a mixed family where some persons are documented and some are undocumented, the family can be a part of that. Okay. Any other questions before I go on? Okay, I'm going to skip over. This is, I'm going to skip over the next slide. This is great. Y'all have great questions. So it's already 12:40. Great. Okay, that's great. 20 more minutes, right? And by the way, I'm going to end right at 1. So you don't have to be like, oh, is he going to end? No. Sometimes people just go on and on. That's not, I don't like that when people do that. Okay, so here is Feeding America's Map the Meal Gap. If anybody's ever interested, you can look at any individual county in the United States, what their food insecurity rate is, and things like that. But I'm not going to talk much about this in the interest of time. Okay, but I do want to talk about one group in particular. Remember how at the outset I said that solving food insecurity is relatively easy for a large segment of the population? I don't think that's the case always for people with disabilities. Okay, food insecurity rates amongst persons with disabilities, and by what I mean is this, I should be more precise. Households with at least one person with a disability, whether it be a parent of that child is in a house with somebody with a disability, or a child with a disability. Okay, you see here how much higher the rates are amongst households with somebody with a disability. Okay, I mean, to some extent that's to be expected. Persons with disabilities, on average, how these households have lower incomes, right? But look at this next slide. This is basically subsetting on those below 20% of the poverty line. So if you look at other demographic groups, once you subset on below 20% of the poverty line, less than roughly $50,000 for a family of 4, there's no difference in their rates. Okay, so for example, if you look at Hispanics versus non-Hispanic whites, Hispanics have higher food insecurity rates. Once you segment on income, they actually have, in some years, lower rates of food insecurity, but not true with persons with disabilities, still higher. So this is not really only a resource issue. There's a lot more going on with this. And this afternoon, I'm going to talk a lot more about this because it's an exciting, it's the most important area for research, in my opinion. And we got to do a lot more in this area. But this is an area where a large proportion of people who are food insecure have mental health challenges. Okay. And so to some extent, just giving more resources may not get at the crux of the problem of why they may be facing these challenges with respect to being food insecure. Okay. So even though earlier I said it's all about resources, it's all about resources conditional upon the challenges that individuals face. I guess I would say, to be more precise. So we can't forget about people who are left behind as food insecurity rates decline dramatically. Okay, so who's eligible for SNAP? There's 3 criteria with respect to this. The first is the gross income test. So this is basically whatever your usual income is, it has to be less than 130% of the poverty line. Okay, California, like a lot of states, have set this higher. It's at 200% of the poverty line. Okay, which potentially can bring more people into the program. Then there's the net income test, where your income has to be less than the poverty line, which is your gross income minus these different deductions. Okay, so that's how we calculate who is eligible. So you have to be gross income, net income eligible. And then perhaps one of the stupidest tests is, I mean, I can justify the gross income test. I can justify the net income test. I think they're reasonable. The asset test, I can't justify. If somebody wants to save money, and I don't care if people save money. Some people want to save money, some people don't. That's not my, I'm an economist, whatever people want to do. If they want to save money, they don't want to save money. But it's wrong to have government policies which explicitly discourage them from saving because they have this asset test. California, to its credit, does not impose this asset test. Okay, so this is who is eligible for SNAP. So I don't have a sense about the patients coming through this area, how many are eligible for SNAP or not eligible. I know it's probably some hospitals in San Francisco which have a high proportion of the people coming through there SNAP eligible, other areas not. Okay, and then what's done then is that the way that benefits are set is that you take the maximum amount minus 0.3 of net income. So back to what I said earlier, today, and this is 2022 maximums. A family getting the maximum is getting about $11,000 a year in benefits for a family of 4. Okay. For various reasons, I think this can be higher, but this is pretty generous, especially in San Francisco, given your crazy high food prices, it's a little bit more of a problem. But in areas like Houston with more reasonable food prices, it's less. It's really a pretty big amount. Okay. And so you have this pretty generous. Now, coming back to your question earlier about getting rid of these emergency allotments, I think the emergency allotments were a great idea. Everybody was bumped up to the maximum SNAP benefits. Here's why I'm against having the maximum allotments at all times. It is the following senses. A lot of welfare programs in the United States are really poorly designed, such that if you make $1 more than the threshold, you lose all your benefits. Medicaid is the classic example. Medicaid may be great over many different dimensions, but it has this huge cliff effect. And therefore, if I'm going to be told I make $1 more, I'm going to lose all my health insurance. I'm not crazy. I'm not going to take that job or those extra hours. Okay. SNAP doesn't have that feature because for each additional dollar you make, you lose 30 cents in benefits. I think that tax is too high, as Hillary has correctly pointed out. I think that tax is too high, but still, as somebody's income increases, is their benefit levels slowly fall away. So there's not a cliff effect in SNAP. If everybody continued to get the emergency allotment, again, it was a good idea at the time, you have this huge cliff effect. I mean, if a family was getting close to the cusp of being eligible for a SNAP, and somebody said, you can work a few more hours this week, and they're like, that's gonna make me ineligible for SNAP. Why would I want to get $200 more in cash over the course of a year if I'm going to lose $12,000? So this is part of the reason why the emergency allotments were an excellent idea as a short-term solution, and kudos to the government for doing it. It's not a good long-term solution, in my opinion, because these cliff effects are a big deal. I'm going to talk a little bit later about the dignity and autonomy of SNAP that gives people. SNAP also gives people the dignity and autonomy to work without being punished. Okay, I think that's really a critical, nice feature of SNAP. So here is the application process. And somebody already asked about this, so I'm not going to talk about this anymore. You establish eligibility, you have initial certification, then you have to recertify. Now, why don't people not apply? The main reason why people don't apply is the fact that for some people, they may be getting $50 a month. They're like, look, it's not worth the hassle to get SNAP benefits. It's not worth the stigma associated with it. Unfortunately, there can be stigma associated with SNAP. And that stigma comes from across the political spectrum over different dimensions. So some people feel stigmatized when they use SNAP benefits. And there's also, unfortunately, transaction costs associated. So children, roughly participation rates are 90, 95%. It's really high amongst households with children. This 18 to 59-year-olds, that's where you get low rates that aren't readily explained. Okay, so this. Now, here's what happens. So one of the first advantage of SNAP is the benefits are well targeted. Okay, is you have to apply for this and it's well targeted. The second advantage of SNAP is that it's an entitlement program. It's an entitlement program over two senses. The first sense that's an entitlement program is I can stay on SNAP for as long as I need to. I mean, there's various requirements, but if I need to be on SNAP for the next 20 years for some reason, I can be on that program. It's an entitlement program. You can't take those benefits away from me, except in some instances. We can talk about those if we wish. It's also an entitlement program insofar as the program automatically expands and automatically contracts. It doesn't require approval of Congress every year to increase benefits or to expand the size of the program. The program, what we call it, it's automatic stabilizer. It automatically increases. So this is, and what this slide really shows is the fact that, over time, as more and more people have been able to get in the program easier, and there's been less stigma associated with SNAP for reasons we can talk about if we wish, is that there's been a steady increase in this. Now, starting back, middle of the Obama years, is that economy started expanding. This fell. This continued all the way up to 2019. So we'd expect this number of people receiving total expenditures. It's an entitlement program, so it automatically expanded, then automatically contracted. Now, there's a huge increase in 2020 due to the emergency allotments, and there was another huge increase in 21 and into 2022 as maximum SNAP benefits increased. Okay, but this was all automatic. So that's the second reason SNAP is great. It's an entitlement program. You can't take these benefits away. The third reason SNAP is a great program is that you wouldn't want to give somebody a benefit and then say, but you could only utilize it at certain places. Okay. SNAP is available at almost all food stores in the United States. And I want to counteract one myth that some people have about SNAP. Is oftentimes people say, CalFresh, that's what it's called here, CalFresh. Okay. You'll see signs on stores, CalFresh accepted here, CalFresh accepted here. The main places where you see CalFresh accepted here is going to be at convenience stores, right? Because roughly, almost 70% of the stores that accept SNAP are convenience stores or other types of small stores. Okay, so sometimes people have this impression that SNAP users are going to these convenience stores to do their shopping. In the main, they're not. They're going to the Walmarts of the world. 52% of all SNAP dollars are spent at superstores. Another 29% are spent at supermarkets. Okay, just like Walmart. This is just like everybody else's low food prices, affordable, safe, nutritious food. This is where people on SNAP are shopping. They're not shopping at convenience stores, and this is really important to emphasize. I think sometimes people get the wrong impression about SNAP because of this. But in fact, 1 out of every 3 SNAP dollars is spent at Walmart, as you might expect. So I wanted to take this. But the main point I want to make about this is just the fact that if I get these benefits, I can go just about anywhere to use my benefits. And the final reason why I love SNAP, and this will kind of get us a little bit towards the end, is this notion about dignity and autonomy. I always tell people, it's not easy to be poor anywhere, but it's not easy to be poor in the United States. It's never easy to be poor anywhere. But one thing I just don't like is that so many people in our country, and various, again, left and right, are so judgmental about poor people. And they oftentimes feel I should be telling vulnerable in our midst what they should and shouldn't be doing. Okay. There's a lot of people like that. Maybe some of you know people like that who really try to tell the people what to do. Okay. In ways that we would never tell anybody else what to do. So this is what I love about SNAP, is that it gives recipients dignity. Okay. Is if I'm a SNAP recipient, is I can go to a food store and shop alongside my neighbors and friends. I don't have to go to some other location far away or something. I can shop alongside them. Okay. Another way that gives dignity is, unlike a lot of other welfare programs, is it doesn't punish you if you want to work more hours. You're giving them dignity to say, if you want to work more, great. On the other hand, though, coming back to what I said before, it's an entitlement program. If somebody says, I don't want to work more for whatever reason, again, It's not for me to judge whether or not why somebody isn't working. That's not my judgment call to make. But is that if you wouldn't want to have a government program that discourages people from working. The other thing it gives SNAP recipients is autonomy, okay? Such that if I'm a SNAP recipient, I can make food choices that are consistent with the preferences that I have over food, with my culture, and the constraints of my family. I don't need some government do-gooder to tell me what I can and can't eat. I make those decisions on my own. And in that sense, I'm given the same autonomy others have given. Because I remember you always meet some people who want to constrain what SNAP recipients can choose when they go shopping. Sometimes you'll see this happening. Proposals, again, from both the left and the right, to restrict what people can and can't purchase with SNAP. And my response is always the same to this is, we don't do this to other people in our society, okay? Every year I get a mortgage tax deduction. That's a dumb idea, the mortgage tax deduction, but I'm going to take it every year. I get my mortgage tax deduction. The government would never dare to tell me how I can and can't spend this mortgage tax deduction, which is basically the government giving me money. I didn't do anything to earn this money. The government's just giving me because of this mortgage tax deduction. Or when I used to work for USDA, is that at that point, is when I worked for USDA, they never would have dreamed to tell me what I can and can't spend my money on. Okay. So we should afford the same dignity and autonomy to SNAP recipients and not say, here's what you can purchase, here's what you can't purchase. Okay. I want to go into, so these are the 5 main reasons SNAP is great. Well directed towards those who are most in need. It's an entitlement program, plenty of places to shop, and it gives dignity and autonomy to recipients. Before I go on to, I want to go on to this slide before I do anything else. SNAP is by far the most successful government program we have today, bar none. I really don't think other government programs would be happy to have this level of success. SNAP participants are 30% less likely to be non-participants to be food insecure once you control for non-random selection into the program. This is an econometric technique that's used, but non-random selection. At any rate, incredible success. Okay, so all else, if you took away SNAP tomorrow, is you'd have this gigantic increase in food insecurity. The next point I want to make is what happened from 2019 to 2021. This comes back to some of the questions that you all have been posing. I think this is fascinating. Look at this. From 2019 to 2021, the decline in food insecurity for the country as a whole was 34. Well, you can see these numbers. That was the decline in food insecurity over this time period. Okay. For various reasons, there's a lot of SNAP recipients who are still food insecure. The decline in food insecurity among SNAP recipients over this time period was 18 million to 16.9 million. Almost 80% of the reduction in food insecurity over this time period due to these expansions in SNAP was due to SNAP. I mean, we can't talk about the success of what happened during COVID without talking about how amazing SNAP was in reducing food insecurity over this time period. We also can't talk, let's see, time is it? We also can't talk about how successful SNAP can be in the future without this talking about how the fact that it led to this huge decline. Now, note that from 2014 to 2019, that was due to economic growth. There was really not much changes in SNAP. So we can't say that was due to SNAP. But from 2019 to 2021, when we dramatically expanded this program, this then led to these declines. So 2 more slides. But again, I said I'm going to give you immediately at 1 o'clock. But were there any thoughts or comments about anything that I've said up to this point?
Question of that.
Okay.
About whether SNAP is accepted at farmers market.
Yes. So SNAP is accepted at farmers markets, which is great. The more people can shop at different places, that's great. One of the challenges was that there was a time where they had something called double up bucks, where you could spend more money on fruits and vegetables at farmers markets with SNAP dollars, but you couldn't spend it at, say, What's the big store? Ralph's? Is that the most common store? What's the most common store up here? Safeway. Okay, you couldn't spend it. Ralph's is in the southern part of it, right? You couldn't spend it at Safeway to get. It was a crazy thing. So it's great that people can spend the money at farmers markets. In general, poor people don't shop at SNAP recipients. Don't shop at farmers markets because oftentimes they're much more expensive and they don't have the wide selection. But is that they are accepted there. Coming back again to this notion about dignity and autonomy is. If I enjoy shopping at farmers markets and I want to spend my SNAP dollars there, yes, I can do that. So in other words, this is one of the great things about SNAP. Any other questions or comments? Okay, I love SNAP. Thank you.
I just want to again thank Dr. Gunderson and the Bramham family for this wonderful opportunity and wonderful introduction to SNAP, and encourage you to join us at 2:00 to continue this conversation.